Hospital. Hari ini bersama saya Dokter Dokter Nuklir di Beacon Hospital.
Good afternoon, Ms. Mina. Hi, good afternoon everyone.
Di sini kita ada beberapa pertanyaan yang apa itu PET CT scan?
So PET CT scan is a type of scan that we usually do mainly for patients with cancer.
Okay.
So for example, now you have a patient diagnosed with breast cancer or colon carcinoma, bowel cancer. We want to know whether the cancer has spread to other parts of the body. So meaning to say, in our terminology, we call it staging scan.
Okay.
So that is the use of PET scan. So PET scan is a technology where they combine two modalities into one machine, and we acquire the scan simultaneously. So, and the patients who require PET scans are usually patients that we suspect to have cancer or confirm to have cancer, so that we know how to manage or treat them accordingly. So most of the centers in the world, we use PET scan mainly for patients with cancer, but there are also other indications for PET scan. For example, if the patient has any infection, we want to see the response to the treatment and etc. We can also do a PET scan.
I see. So not only confined to cancer patients.
Yes, true.
Patients have to submit their previous report like MRI, ultrasound, or CT scan, and then including the CT.
Yes, we usually at Beacon Hospital we request for all necessary information.
Okay.
Because I believe when we do the PET scan, it has to give answer to what the referring doctor needs to know. So most of the time, these patients would have had MRI scans, ultrasound scans done elsewhere, and these are important for us so that we can compare all the previous scans with the PET scan that we are doing. So the reason why we ask for all this information is for the benefit of the patient. Actually, it's more work for us, but we want to give the best to the patient.
Yes.
So that is the reason why we request everything from the patient.
Okay. How many types of PET CT scan we have in Beacon Hospital?
So PET scan, there are many types of scans that we can do with the PET scan, PET CT machine.
Okay.
So the most commonly used radio tracer is 18 FDG. So in oncology cases, 90% of the time we use FDG PET scan. So FDG PET scan, you can use it for almost all types of cancers, for example, breast, colon, lung cancer, and etc. So basically, FDG PET scan basically looks at the glucose utilization and absorption of the cancer cells. So that is FDG PET scan. But there are also other types of PET scans such as Gallium 68 PET scan, which is important, and there are many subtypes, like for example Gallium 68 PSMA PET scan, which is meant specifically for prostate cancer. So patients with prostate cancer, sometimes when you do FDG PET scan, you don't find anything significant. So that's the reason why we do PSMA PET scan for patients with prostate carcinoma. So similarly, like in other cancers like neuroendocrine tumor, you need to do a Gallium 68 Dotatate PET scan. And there is also now a new modality which we call as Gallium 68 FAPI, which stands for Fibroblast Activated Protein Inhibitor scan, which is more specific, and it looks for any cancer cells which are present, which were not detected on FDG PET scan or other conventional imaging.
Okay, noted, Dr. Rangis. Why the Gallium 68 scan is more better than conventional?
Okay, so conventional imaging, which means our routine CT scans or MRI, like for example, let's take a patient with prostate cancer. So once we know the patient has prostate cancer, usually the referring doctor needs to get a MRI prostate done to look at how severe the disease in the prostate. So that is what we call as local staging, and we are only looking at the pelvis. And then, since most of the time prostate cancer spreads to the bones, we also need to do a bone scan. So these are two different scans, two different machines that you have to do at two different times, and it takes a lot of longer time to get all the necessary information. On the other hand, PSMA PET scan is a single imaging modality where you get all the information required, because we do the scan from head to mid-thigh, and you can look at the prostate, you can look at the bones, you can even look at other parts of the body. So that's the advantage and superiority of doing a Gallium PSMA PET scan for prostate cancer. So similarly, any other Gallium Dotatate PET scan or Gallium PET scan in other malignancies.
Okay. So is Gallium-68 readily available for PET imaging?
Yes, at Beacon we do Gallium-68 PET scans daily. So we scan at least about 3 to 6 patients every day.
Oh, Beacon, and then PET CT scan, the FAPI test.
Okay, so PET scan at Beacon, FDG PET scan is only about RM 2,200 ringgit per scan. Gallium-68 PSMA PET scan and Dotatate PET scan is about 3,400 ringgit Malaysian. Gallium-68 FAPI PET scan is about 4,800 ringgit.
That's more accurate, for this.
More accurate and more specific, but not in all cases we
Yes,
need to do
correct.
FAPI PET scan.